Teeth whitening or bleaching is a simple non-invasive dental treatment used to change the color of natural tooth enamel and is an ideal way to enhance the beauty of your smile. The most popular method is using an at-home teeth whitening system that will whiten teeth dramatically. Since teeth whitening only works on natural tooth enamel, it is important to evaluate replacement of any old fillings, crowns, etc. Replacement of any restorations will be done after bleaching, so they will match the newly bleached teeth. Teeth whitening is not permanent. A touch-up may be needed once a year, and more often if you smoke or drink coffee, tea, or wine. Reasons for teeth whitening: fluorosis, excessive fluoridation during tooth development, normal wear of outer tooth layer, stained teeth due to medications, tetracycline, etc., yellow-brown stained teeth. What does at-home teeth whitening involve? Whitening systems provided by our dental office usually require 2 visits. At the first appointment, impressions, molds will be made of your teeth to fabricate custom clear plastic trays. At your second appointment, you will try on the trays for proper fit, and adjustments will be made if necessary. The trays will be worn with special whitening solution, either twice a day or overnight, depending on the degree of staining and desired level of whitening.